Metal fillings, amalgam fillings, silver fillings, or as I call them, mercury fillings. These, I think, are some of the most toxic things that you can put into your mouth. And in our practice, we specialize in the removal of these fillings. Why? Because they contain close to 50% mercury. And we know that mercury is a very dangerous neurotoxin. It's a very dangerous metal that impacts several different organ systems in our body. And it's just something that if we're trying to achieve ultimate wellness or health, we just want to eliminate that from the equation. So these fillings, they've been around for a long time. And thankfully, I feel or I've seen that there are less practitioners that are placing these types of fillings, but now we have an epidemic of people who have had these fillings placed throughout their life, and now they want them removed. And what's really key here is that you're removing them safely. So when we drill any of these mercury fillings out, that creates an aerosol or a mist of mercury that then you can breathe in or fall on your skin or ingest, and can almost be like a dump of mercury into your system. And so we take several steps, and we're actually certified with a technique that's called SMART. It stands for Safe Mercury Amalgam Removal Technique. And this process involves protecting the patient in every way possible that we can to mitigate any exposure, as well as protecting ourselves, myself and my assistant, while we remove these mercury fillings. It is a pretty easy process, and I think once patients go through the initial removal, they feel a little bit better and they're not as anxious. But again, I've had several wellness practitioners who will do heavy metal testing. We even do heavy metal testing in our office, and we can actually identify mercury in our blood, but more specifically elemental mercury that comes from these mercury fillings. And we can do tests before the removal and see elevated levels of mercury. And then after these removals and a bit of detoxing, we see those levels significantly decrease. These fillings are leaching mercury always and forever. They never stop leaching. Even the ADA acknowledges that there is mercury that is off-gassed from these fillings on a daily basis. They just say that it's such a small amount that it really doesn't impact us. But as we obviously know, when it comes to more personalized medicine, that everybody kind of responds a little differently to some of these harmful toxins in our environment. And so our goal is for folks who want to have them removed, to do it safely and do it correctly. So I really encourage you, if you are planning to go through the process, find a practitioner who's certified under the SMART technique and have it done properly to protect yourself.